I just want to clarify too. So polycystic ovaries, cysts on the ovaries, doesn't necessarily mean polycystic ovarian syndrome.
Yeah, and just to add on that, you mentioned about snowboarding and obviously activity, and then the activity ceases or slows down considerably, and then the insulin resistance starts to happen. And
hypothalamus and pituitary also control the ovarian axis, the gonadal axis, and also the thyroid as well, which controls metabolism throughout the body.
Let's go on to the next topic of what can be done. What can women do? So let's get started right into it. There's a few terms around, obviously female hormones are very complex compared to male hormones.
Yep.
But with female hormones, a lot can go wrong, but particularly the term PCOS and polycystic ovaries as well. Mm-hmm. Can you shed a bit of light on that topic for us?
Yes, look, it's starting to become more commonplace now. I think more people are hearing of it. The prevalence of it, it's around 5 to 10% of women suffer from PCOS or PCOS, which stands for Polycystic Ovarian Syndrome. And it's basically a condition where, when we say syndrome, it's numerous things are going on. So it's never just one specific symptom or one clear picture. And we're still learning things every year. There's more and more information that comes out with this. And I just want to clarify too. So polycystic ovaries, cysts on the ovaries, doesn't necessarily mean polycystic ovarian syndrome. So there's certain criteria that needs to be met for that. And 2 of the 3 criteria, if they're met, then it's considered polycystic ovarian syndrome. That may have changed. I'm sort of going back to more like, I think this was criteria in 2003. What's more common place with polycystic ovarian syndrome now is the understanding of the blood sugar dysregulation that goes along with it too. And again, that plays into hormone picture and insulin and androgens and the likes. Yeah, so basically the criteria that needs to be met too, it can be oligo-ovulation, or it's a lack of ovulation for a certain time, and increased androgen levels, and a cyst on the ovaries. So if 2 or 3 of those criteria are met, then it's considered polycystic ovarian syndrome. And in addition, you're really looking for that blood sugar dysregulation as well. So yeah, it's quite common when you really look at those percentages. And as you know, in practice, you come across it quite regularly.
And just to go on to, it's quite regular, but also maybe you can shed some light on the kind of textbook presentation, but the difference and sometimes the true presentation.
Yeah, so when you learn this particular syndrome, we're told about the women who put on weight, carry a bit of weight, and with the high androgen levels might have hair growth in areas that are unusual and not wanted, of course. And you've sort of visualized this picture, and if you look for this type of picture in practice, you'll quite often not find it. It's really, most of my polycystic ovarian syndrome patients that I've come across over the years have not presented that way at all. And quite often they're they look like they're very fit young females, and they present quite healthy just by taking a look at them. And then you sort of work out one of the telltale signs is the blood sugar dysregulation and going to their diet. And I found this has happened several times with my patients. Is there've been female athletes that have really had probably a higher carbohydrate diet than what they needed. Well, at the time they may have needed a high carbohydrate when they've been performing at high levels in their sports, or chosen. Some of them have been snowboarders or so forth that I've treated, and they've stopped for whatever reason. They've stopped that interest, but their dietary habits haven't changed, and we see this a lot with athletes. Diet can fluctuate, their weight can fluctuate, but in some cases the weight doesn't necessarily fluctuate that much, but the blood sugar levels do, and then there's a disruption to the whole endocrine system that controls all the hormones, and then androgen levels can increase as well. And that picture of anovulation that I spoke of before, which is when someone's not ovulating, they don't have their period for several months, and it is another telltale sign with Polycystic Ovarian Syndrome, that athletes can also experience that as well, and not consider it being possibly being Polycystic Ovarian Syndrome as well. So it's an important thing to look out for, and that's when you start questioning, and these things come through, and you go, okay, you haven't had a period for it, or it's been irregular for a long period of time. Blood sugar levels are out of whack, and other things can tell you whether their moods are out and so forth, and their dietary habits, their cravings, and so on. So so this is quite often what I've dealt with in practice, and not that typical, perhaps that incorrect picture that we get told or taught in class back in the day.
Yeah, and just to add on that, you mentioned about snowboarding, and obviously activity, and then the activity ceases or slows down considerably, and then the insulin resistance starts to happen, and then there's the feedback loop back to the hormones and back to the periods. Yeah, excellent. So let's go on to the next topic of what can be done. What can women do?
Yeah, look, it's a great question. Look, it's I think the naturopathic approach is really good here, and I think for female reproductive issues in general, because of this holistic picture, it's we're looking really at the dietary issues here. The blood sugar dysregulation is a lot we can do naturopathically, and I think that's an important part of it. And a lot of people don't relate, or a lot of women don't relate hormones to excess sugar intake, for example. So, I mean, that's really a big part of it. And when we're treating this condition, that's what we're trying to manage straight up. We're trying to manage this sugar dysregulation and high blood glucose or insulin that's out of whack as well. So it's very important that we look at that facet of it all. Look, and the one thing I haven't mentioned yet is the hypothalamus pituitary ovarian axis, and we've covered the HPA axis in a previous talk, and that comes up quite often. People starting to be familiarized with hypothalamus pituitary adrenal axis, but the hypothalamus and pituitary also control the ovarian axis, in men gonadal axis, and also the thyroid as well, which controls metabolism throughout the body. So stress comes into play here.
Definitely, yes.
Big time, and dysregulates that whole hypothalamus pituitary axis, whether it's thyroid, adrenals, and in this case, the ovaries. So I think this is really important to manage your stress, manage your blood sugar levels. If you've come off high exercise, and you're doing, you quite often what happens, they'll have come off a high exercise period, had increased carbohydrate diet, and then they might be doing more desk work or something like that too, in their day-to-day dealings. So yeah, I think be conscientious of that. If that's not your picture, if you are someone that has put on a bit of weight and so forth, again, you've got to manage the blood sugar levels and try and maybe add exercise or different exercises to your routine. But like really, when we say the exercise word, some people shy away from it and fear it. Exercise might be meaning that you just get up and get busy with around the house and do a few things. But also what I try and encourage my patients to do is just some way work up a sweat, really get that change in your physiology. And that for some people could mean taking a hot bath, go to a sauna. It could also mean just doing a bit of work around the house. It could be sitting down doing some breath work and yoga as well. So I think they're really valuable things. And time is really the essence why people don't, or they don't have enough time, and they tend to put off things like exercise. And I always encourage them, well, what about a nap that can help you? What about a 7-minute workout? These high intensity workouts can really be beneficial to a lot of people. And if high intensity is not for you, you can adjust the exercises and the level of intensity, but you're still in that 7-minute period, you might be able to work up that sweat, and that's enough exercise to make big changes. I know with a lot of my patients, and even with myself, when I add a yoga session once a week, just once a week, it changes a lot. It changes my mood and everything. It centers me, and it can make a huge difference. And that's, I think, important for people to know, is even if you just do something once a week and commit to it, it can make a difference. So really be conscientious of that. And, if you work on that blood sugar dysregulation, that has a great flow-on effect for the rest of the condition. Obviously, we're trying to directly treat hormonal dysregulation with our herbs, and any nutrient deficiencies as well, that quite often come up in these scenarios. So there's plenty that we implement as well as naturopaths.
Excellent words of wisdom from Brad. Yeah, and if sometimes it can seem a bit of a challenge, as Brad said about with exercise, and if you don't start now, then that can be the hurdle, that initial step, but better to start now than possibly never.
That's
and
right.
Every little bit that you do will be a benefit. Yeah, excellent, Brad. Thanks so much for sharing all of that information with us.